Hey everyone, I'm your host, Dr. Dean Mitchell. Grab a seat, get ready. You're about to enter the Smartest Doctor in the Room podcast. Today's topic is going to be about how taste and smell reflect your health. Now, taste and smell are commonly thought of as culinary senses, which mainly are for our enjoyment. We all know the smell of hot pizza or bacon in the frying pan. But what if these senses had a profound influence on your health and predicting whether or not you would develop an illness? More and more research has found an association between taste and smell in regards to aging and diseases. Now, COVID-19 demonstrated how a powerful virus can eliminate our sense of smell, but medical research has been finding that even more evidence regarding the condition anosmia, which really is the medical term for loss of smell, can be the preliminary symptoms associated with neurologic and autoimmune diseases. My guest today, Dr. Richard Doty, is the director of the University of Pennsylvania at the Perelman School of Medicine's Smell and Taste Center. And he's also a professor in psychology and the Department of Otorhinolaryngology. So quite an assortment there. He has published over 400 scientific papers. He's published 10 books on the subject. He is the, as we say in sports terms, the GOAT, in this field, the greatest of all time. So I'm really pleased to welcome Dr. Doty to the podcast.
Pleased to be here. Thank you.
Okay, so I guess the first question I have to ask you, how does somebody determine to go into this field of taste and smell? Like what made you want to pursue this as your life's work?
I got into it very early on in zoology because I was interested in animals and how certain mice would differentiate other mice on the basis of smell. I won't get into a long story about it, but I was very interested in what's called speciation, which is among certain mice, the genus is a mice, Peromyscus is the name of the genus, that how do they keep apart from each other once they become species, and smell is a big player there. So I really got into it from the animal end.
That's interesting you say that, because that was like the next question I was going to ask, is that I said that we know that animals seem to have a much keener sense of smell, and they utilize it in assessing interactions with other animals and people. Now, obviously, you eventually made the switch to humans. Did we ever have that type of ability, and did we lose it, or do animals have more, olfactory neurons than us? I mean, it's kind of fascinating. It's interesting. I saw in 60 Minutes once a couple of years ago, like how they literally trained dogs to diagnose bladder cancer by having them smell urine samples, after they trained them on which samples had cancer. So I was just curious, like, I mean, did we ever have that ability, or did we lose it because we didn't use it?
Well, surprisingly, for a lot of chemicals, we're very sensitive. And indeed, for something like banana oil, we're just as sensitive as rats to banana oil when you measure through various techniques. Uh, we don't dream in terms of smells, and I think animals, some dogs might dream and think in terms of smells. That's sort of beyond our brains. But there is a big difference in certain species, like dogs have many more receptors than we do. To give you an idea,
Receptors or actually neurons?
both.
Okay.
Yeah, but they have the cilia that contain the receptors and the olfactory epithelium at the top of the nose of the dog. If you calculate the length of those cilia and how many are there, it's about the area of that is about 1.5 times the surface area of the dog. Humans, it's only about 6 square inches. So you see there's a big difference in terms of the
So anatomically, we're at a disadvantage. But just for our listeners, what Dr. Doty was explaining with cilia, those are the tiny, like hair-like substances that are on certain tissue, and obviously must help, increase the surface area of I guess, the activity of those particular
Yeah,
neurons.
those cilia are on the receptor cells, and that's where the receptors themselves are located.
Okay.
So
So it's an
molecules,
anatomical thing. Okay.
exactly. So there are all those differences. And then if you look at the of course, the human, if you look at the size of the olfactory bulb, it's bigger than the mouse brain or bigger than the rat brain. So it's still quite a large structure. On the other hand, relative to brain size, it's very small. If you look at a mouse or a rat, the olfactory bulb, which is the first relay station of the olfactory system, is about 1/3 the size of the brain, whereas in humans, it's much, much smaller.
Okay, so let's get into probably what our listeners really want to know about, regarding, especially we'll start with smell. What are the dangers in your work of all these years of loss of smell, whether, I guess, short term, but especially long term?
Well, there are a number, obviously, safety, leaking natural gas. If you can't smell, you can't detect gas. There's other environmental hazards where odorants are present that people should avoid. Uh, Spoiled food is another example. If you can't smell, you may miss something being rotten. Most of what we think of as taste is really smell, by the way. And therefore, anything that, when you lose your smell, you lose your flavor of foods as well. Uh, so that's those
Wait,
are
so you're saying that if you lose your sense of smell, you lose your sense of taste as well?
in effect everything but sweet, sour, bitter, salty is dependent upon molecules going from the oral cavity up through the rear of the nasal cavity, so-called nasal pharynx, to the olfactory receptors. And so chocolate, strawberry, coffee, everything you generally think of as taste is really dependent upon the sense of smell. You can
Mm.
test this yourself by holding your nose shut, putting coffee or chocolate in your mouth, then open up your nose. You realize when your nose is shut, there's no sensation of chocolate or
That's
coffee.
very interesting. Yeah, when you get to the conditions, because I mean, obviously that takes away the pleasure of food. It can affect people's diet and obviously their overall health if they, because like as I mentioned in the introduction, when you smell that pizza or that hamburger and fries, your appetite gets stimulated by the special
Sure.
wonderful smell.
And loss of smell signals a number of other things. Early stages of Alzheimer's disease, early stages of Parkinson's disease, a number of neurodegenerative disorders like that. So it's also, if you're over the age of 65 and you can't smell, you're 3 times more likely to die over the next 6-year period. So it's sort of an index of overall brain health as well as a marker for a lot of neurological diseases.
Do you think I was thinking about before we did this podcast, is it the chicken or the egg thing? Is it that those diseases present by having you lose your sense of smell, or is it, the process of aging, losing your smell makes you more predisposed to getting some of those neurologic diseases like Alzheimer's and Parkinson's, which we'll get into?
Well, both are possible. Certainly, certain agents, viruses, for example, get into the brain through the olfactory pathways. And in some cases, the viruses are associated with Parkinson's, Alzheimer's, and so on. So there's one theory, the olfactory vector hypothesis theory, that various agents, nanoparticles, get into the brain through the olfactory pathways. Alternatively, certainly certain genetics and other elements are involved in such that when you do have a disease like Alzheimer's, you're going to have some smell loss. So there may be a combination of both, and it's highly heterogeneous because none of these diseases like Alzheimer's are uniform. There's not a single uniform Alzheimer's disease. It's a combination of a number of factors that lead to the dementia and the formation of the plaques and tangles that we think of as pathologically as Alzheimer's disease. But we do know that people who live in highly polluted areas of Mexico City, for example, start to show the signs of Alzheimer's disease in terms of the pathology very early in life, at the age of 10, 12, 14, and cadaver studies have been done. And it's the nanoparticles from diesel fuel, diesel exhaust, and things like that, that can get into the brain and induce some of this pathology. So I think in reality, if you clear up the environment, a number of those neurodegenerative diseases would probably disappear.
That's pretty interesting, very scary at the same time too. I guess that's another push for EV vehicles and everything. Um, Why again too with COVID, this particular virus, did so many people lose their sense of smell? I think I saw an article you wrote about that. Is it that the virus actually destroys? I read also something once in Scientific American. It was actually more of the supportive cells, or I mean, but why versus, when people get a typical, rhinovirus, a cold, even influenza, you lose your, you get congested, you lose your, maybe you may slightly have a decrease in your sense of smell and taste. But COVID was very marked for that loss of smell. And then a lot of people reported everything's tasted like garbage.
Well, interestingly enough, the most common cause of long-term permanent loss of smell is the common cold. People get over
Is it
the
really?
Yeah, they get over the inflammation, they get over the cold. They're typically in their 40s that come in and say, "Doc, I had this terrible cold. It's been 3 months ago, and I'm over everything, but I can't smell." So rhinoviruses, a number of viruses can do what COVID does, or what the SARS virus does. Uh, so it's not uncommon. Influenza, another case. Some people permanently lose their sense of smell after an influenza bout. However, I think COVID was more widespread. Also, it affected younger people more, which is surprising because usually you see the damage occurring as on average in the age of 40 and older. But we know from COVID that this affects 10-year-olds, 15-year-olds, which is quite remarkable.
Well, people also who I've spoke to who've had COVID where they lost their sense of smell, they also said the food tasted like gasoline, I mean, terrible things. I don't even know how they kept their appetite.
Well, what happens is that the way information is coded in the olfactory system, the we start out with 400 types of or classes of receptor cells that express, given each one expresses a certain type of receptor protein. We have about 10 million receptor cells overall, but there's a subclass of about 400. And it's combinations of those firing of those cells that dictate a particular odor. So when you're missing a certain class of odors, for example, let's say that banana smell requires receptor A, B, C, D, and E. But along comes a virus and knocks out D and E. So all of a sudden you have something aberrant coming through that doesn't really smell like banana. Uh, I use the analogy for patients that if you try to get a coordinate note on a piano and then you cut a few strings in the back, everything comes out badly. And that's sort of the process that we think occurs when selective damages occurs to certain of the classes of receptor cells.
Hmm. Now, I'm sure, I actually, one other thing too, I'm curious about because we both may have uh, seen patients with this. I mean, again, in my practice, because I deal with allergy and sinus issues, I've seen a lot of patients over the years with nasal polyps. And aside from not being able to breathe, it was really a horrendously, you know, upsetting condition because most of the patients told me too, they couldn't taste their food. I was just curious, and because I know you work partly with the ENT department at Penn, do any of these patients have long-term medical issues that you're aware of who have the nasal polyps? I mean, now we have some really good treatments, and I know at University of Pennsylvania they've had some great surgeons there that take out those polyps, but they come back. But I was just curious if in your department they've ever seen from these patients that are, for years struggling with, the term anosmia and not being able to smell, if it led to other medical problems.
I don't know much about that, to be honest with you.
No? Okay.
Certainly, autoimmune disorders, almost all of them, even myasthenia gravis, which is usually thought to be a peripheral motor end plate problem, have significant smell loss. In myasthenia gravis, on the 40-item smell test, and the UPS called the UPSID, they score around 20
Hmm.
on average. And that's the same as what we see in Alzheimer's and Parkinson's.
Wow.
So it's very interesting. It may be that cholinergic or areas of the brain associated with certain neurotransmitters, namely acetylcholine, seem to be impacted early. And in myasthenia, people have always thought it had nothing to do much with the brain, had to do with just the motor system and so on, other symptoms. Now we think that's quite different, and they indeed have the same degree of smell loss as I mentioned as Alzheimer's and Parkinson's.
Well, that's kind of scary. What could someone do to try to bring back their sense of smell? I was reading somewhere that like sommeliers, the ones who do the wine tasting, they typically will go to the market and smell fresh vegetables and fruits. I don't know, does any of that help? I mean, do you do that with some of your patients who are struggling to get back or strengthen their sense of smell?
Well, there are kits on the internet that give odors for so-called smell training. And there is some early studies where they gave people a series of odorants to smell before going to bed and getting up in the morning, and purportedly that improved their function. However, a lot of those studies lack control groups and proper double blinding. So I think it's still a little bit up in the air of how effective that is. But certainly we know that uh, people can learn, wine tasters and others can learn odors and make better distinctions. But so, in some ways, it's similar to, say, if you take a course on art, you'll discover that you can start to discriminate between different kinds of artists. And indeed, if you're really good, you can probably tell if something's a fake or not. But that doesn't mean your system has changed, except for what you've learned. So there's a big central component of learning involved in this process as well.
It's interesting. I think I ended up reaching out to you because I had read an article in the New York Times Magazine a couple of weeks ago. It was really fascinating. It was a story about a husband and a wife. He was a physician. She had been a nurse. That's, I guess, how they met. And, they fell in love. And it's funny. One of the things she always mentioned was she always loved her husband's smell. And she seemed to have inherited from her mother or grandmother this hyperosmia. Like she was acutely aware of smells. And later on, in their marriage, he was like in his 40s, and he started to express very unusual like anger episodes and some other things, and which turned out to be eventually Parkinson's. But one of the things that she started to notice that his smell changed to her. And that's what the article was about, how she was really trying to promote, early diagnosis of Parkinson's disease. But I guess there are probably people that have, else, it was like some people have extra good vision or sense of hearing, I guess. I guess there are people that have very good sense of smell, but do they have like a special, what we call a genetic or HLA types that you guys have depicted where some people are just really good smellers? And do you ever in your research like recruit these people to test them versus normals?
Well, it's interesting, and it's a mixed bag, to be honest with you. We did a study recently, just published it, where people who come to the center claiming to be hypersensitive actually have less sensitivity or hyposensitivity on various tests. Sometimes hypersensitivity relates to sort of like fingernails in a blackboard. It doesn't mean that the sound or the experiences doesn't mean you have a heightened sensory system. It's just it affects your emotions or impacts how you perceive things. So if you have distorted smells, we know that that may really be irritating and upsetting to the patient, and they can think of themselves as being hypersensitive when in fact they are not. So there's a whole
So you don't really think there are people that have like an enhanced ability to smell?
well, I think there's a normal distribution of scores. There's people out there at the 99th percentile, others that fall down, the second percentile.
Hmm.
In terms of, for example, during pregnancy, often women report that they're hypersensitive to smells, and particularly in the first trimester. And a lot of women report this, but when threshold tests are done, or when people have tried to tie it down to determine if there was actual empirical hypersensitivity, they haven't been able to find that. Or it's so idiosyncratic that the tests that they're using aren't sensitive to it. So it's very difficult to see the physiological changes that occur in those people who report hypersensitivity, if they in fact are that way. But certainly there's a group of people who are very sensitive. But again, whether they're falling far out of the normal distribution, they obviously are at one end of the tail, but it's not clear that they're beyond that.
Why is it also too that smells evoke sometimes very powerful emotions? You smell something, you walk into someone's kitchen and you're like, oh, it smells just like how my grandmother's kitchen used to smell. Or, um, you can, I know myself too, I can go into a store and sometimes it's very pleasant, sometimes it's very unpleasant, and I have to get out of that store right away. Well, but it's not, it's not that the smell. I mean, sometimes, as I said, it evokes some kind of emotion. Is that understood at all? Like where that, like the whole path of memory and, how
Sure. I
that's.
mean, there is the brain, the hippocampus, which is involved in memory, the amygdala, which is involved in emotion, are intimately associated with the sense of smell. But there are other factors involved. For example, uh, when you smelled your grandmother's pantry, you go through life and never smell that smell again, and then all of a sudden you see it, you smell
Right.
it. Whereas visual stimuli, you're being bombarded all the time, so the novelty is worn off. So that it's a lot of to do with the uniqueness of the initial experience, and then the novelty of that, and then the fact that you don't have a lot of competing things that have wiped that out of memory. Uh, it's funny. I had a fourth grade teacher who I hated, and she always wore a scarf and had octagonal glasses. And a woman got off the elevator the other day, and I never thought of this woman in 80 years, whatever. And immediately brought my memory back to that teacher. So these things happen with other sensory systems as well. But I think it's the uniqueness of the initial experience, and then the fact that the smell system is particularly hooked up, if you will, with emotional responding.
It's interesting too because sometimes I've been to like holistic practice offices and they have incense, and that also can make you very relaxed. It also reminded me, I used to have this professor in college who you'd have to go to like office hours, he'd be smoking his pipe. And actually, of all the, smoking things, that one I actually enjoyed. I mean, I hate cigar smoke and I hate cigarette smoke, but a pipe, smells a little bit, when I thought about it now, it smells like incense, which again, you said it's like touching your somewhere in your emotion of like almost like relaxing you, right? I mean, if it.
Sure. Yeah, and I think there's a lot to that. Not well studied. Also, there's a lot of conditioning that goes on, like the smell of suntan lotion, for example,
Yeah.
bring you back to
That coconut
relaxation
smell,
of
yeah.
being, yeah, or coconut smell.
Well, it's funny. I had a patient that worked for, I can't remember if it was Estee Lauder or one of the big companies, and she was a chemist, and also that was like her job, and I guess they must know all these companies, obviously, because you're dealing with millions and millions of dollars. They know the smells that people, you know, will prefer, I guess, for the most
Sure.
part. And
Yeah,
obviously,
and also what happens in perfumery, often the marketing precedes finding the smell to set the marketing.
hmm
So, once you know the descriptors and the target group that you're searching or hoping to sell to, then you can go in and a perfumer can put together a combination of odorants so that it smells like the marketing. Uh, Also, men and women and the smell have different preferences for odor for different smells
oh yeah.
based on societal things.
Oh yeah,
Uh,
I want to get into that in a few minutes, but I have
sure.
something I was gonna save that. But one more thing on smells too. Things like you go into a fish store, it really smells bad, I mean, are people who work there all day long and they become a little bit, I think, immune to it. But is it bad for their health? It's almost like, oh, so I always think about the garbage men. They're working on the truck. I mean, there might be a little bit pollutants, but mainly it's just a bad smell. Is that dangerous, a profession for any of these people?
Uh, the jury's not in on that. There's not no good studies to look at that. There are rat studies years ago. Pinching was a professor. Professor Pinching had done some studies to show if you're exposed too long to certain odorants, that it would cause degeneration within the olfactory bulb, or the first relay station of the olfactory system, at least in rats.
Because
So that
why? Maybe they're trying to turn it off or something. I mean, like it's trying to block it, so it's just down regulating, possibly.
it's possible. I don't think they ever got into the reason for that. They
Yeah.
just showed through imaging that that's what occurred.
Are there any medications that you're aware of too that affect sense of smell? I mean, I know, I guess, well, like for example, chemotherapy. When you hear people say, "Oh, I can't taste anything anymore," is it mainly affecting their taste or is it affecting their smell?
Both can be affected by chemotherapy because it affects the turnover of cells, and
They're
the cells
destroyed.
of both systems, turn over and new cells come about being. So chemotherapy has a significant effect on both taste and smell. Most medications affect the taste system though, interestingly enough, sweet, sour, bitter, salty. Very few have a significant impact on the olfactory system. Uh, things like Lamisil, the toenail fungus medication, will actually knock out taste to some degree in some people.
Really?
So,
Oh,
yeah, some sleep medications will have aberrant effects in that case, on smell, interestingly enough. So there are a lot of medications in the physician's desk reference, which is a handbook for, looking at side effects and so on of medications. About 1/3 of medications out there will be, particularly cardiovascular medications, will have some portion of people reporting aberrant taste problems. And then some of that happens through saliva. If you chew penicillin, a tablet of penicillin, it's very bitter. And once it gets in the saliva, it can come out in the breath, it can come out elsewhere. Or once it gets into the bloodstream, it comes out in the saliva and elsewhere. So some of the side effects of medication strictly have to do with that.
mm. I once read a story years ago. There was a really good writer for the New Yorker called Bruton Roche. He used to write these very interesting medical, it was called, I think, Medical Detective Series. And he had a case where there was this guy who was living in New Jersey, he had a regular job, and all of a sudden, over time, everything started to taste like garbage to him. And I don't know how, but there was one really specialized physician or someone figured out that he had a zinc deficiency. And when they gave him zinc tablets, his taste returned to normal. But everything like tasted and smelled like garbage. The poor guy, when they wanted to make sure that it wasn't psychological, they swapped out his zinc tablets for placebo for like a couple of weeks, and everything came back, and he was going crazy. And then they told him, no, they just had to make sure, and then they gave him the zinc tablets again. Do you know of anything else like that? Or is there any other vitamin deficiencies or nutrient deficiencies that will make you that prone to a loss of taste or smell?
Well, like with zinc became a very popular uh, treatment.
Right, for
Unfortunately,
colds.
yeah, if you don't have a zinc deficiency, it doesn't work. And so there's a whole era where that was being given all the time. Vitamin A, vitamin D, B12, all of these have been associated one way or another with some alterations in both with taste and smell. Very good double-blind studies are lacking still, surprisingly, for a lot of these vitamins and so on. But the zinc story, in terms of a panacea, is uh, is has been closed. It can actually be, if you don't have a frank zinc deficiency, taking zinc can actually have some negative effects.
Yeah, I was about to say, I thought that was the paradoxical thing. There used to be one of those sprays that they used to try to say protects you against colds that I think had zinc, and sometimes people lost permanently their sense of smell, right?
That was Zicam, yes. And
Yes, right.
the FDA took it off the market for a while until different formulations were found. Certainly, yeah, the zinc ion, zinc gluconate in this case, gets high up in the nose and can damage the olfactory receptors.
Really. Are there other nasal sprays? Because, again, we frequently use nasal steroids, um, sometimes antihistamines, to help relieve people from severe nasal congestion. Are any of those concerning, causing damage to the sense of smell?
Well, I think with long-term usage, that can happen. We did a rat study a number of years ago showing that in developing in young rats, that high levels of zinc, excuse me, high levels of steroid, prednisone, for example, could actually damage the tissue. So it really depends on the amount of, how much dosage is present. But certainly, the FDA now requires any pharmaceutical company who's or at least they strongly suggest that any pharmaceutical company that makes nasal preparations test the sense of smell to be sure that they're not damaging that.
Well,
And
how
that's
can they do that though? Because it'd have to be over a long period of time, right? I mean, it would probably be, you know, I mean, lots of these people use these nasal sprays for years.
yeah. Well, in terms of the suggestions from the FDA, they just have. I know because I am associated with a company that makes smell tests, And basically, we know that the FDA requires clinical trials often to test smell before and after the use of the
Good
intranasal
safety.
medications. Yeah.
Yeah. Let's get on to something that's a little interesting and kind of fun, maybe interest the listeners. It's about the scent and attractiveness. There's that famous experiment. I hopefully you've heard of it, the dirty T-shirt uh study, where researchers had women smell various dirty T-shirts of men and see which ones they were attracted to and which ones they weren't. What does this tell us about anything? Was it have to do with pheromones? I mean, or was it just a headline grabber?
Well, it's probably combinations of both. I wrote a book called The Great Pheromone Myth that got into the whole concept of pheromones in mammals a number of years ago, which I think had an impact on the scientific community because of the issues of what a pheromone is and what, definitions, and it's all over the place. It's not really a scientific term. In terms of preferences for axillary odor, odors of the armpits, in general, people can tell the sex differences. They can tell if it came from a man and a woman, but it's on the basis of the strength. So if you present weak odors that all came from men, they'll tend to be called female when contrasted with male odors. So there's a whole story there. Meat eaters end up having a bad smell, or more of the
Who had bad smells?
people who eat a lot of meat. That will change the,
Beets.
yeah, like, steaks and hamburgers. So people that are big
Oh,
meat
beef.
eaters,
I'm sorry, beef. I thought you said beets. Beef.
yeah, a meat, MEAT. They,
Okay, meat.
yeah, they will
Okay.
basically
They had they
have,
had a bad smell?
they'll have, yeah, they'll have a worse smell than
And why
others.
is that?
Well, it comes out in the axillary area in the apricot sweat, and then the bacteria that operate that produce body odor. So that's related to that. Most of the body odor that we experience is due to bacteria. If you really get rid of all the bacteria in the armpit, you won't smell like
Yeah,
body.
that's that whole thing with Lumi now. There's a gynecologist who's trying to make millions.
Yeah,
I
yeah,
looked it up. I think it's called malodinic acid or something. But mainly what it does is like what you're saying is it clears the bacteria,
yeah,
um, to hopefully get rid of odor.
yeah. I think, but back to the issue of whether people being attracted to certain smells more than others. Certainly, some people's armpits will have a more spicy smell. Again, it relates to all kinds of things like diet, habits, sleeping. It's complicated. Uh, the
So you're
simple
saying like if
idea,
you eat a lot of garlic, that's gonna come out in your system.
absolutely, yeah.
Yeah.
And if you like garlic, you're going to like that.
Well, it's okay if you like garlic eating it, but maybe your spouse or your girlfriend or whoever is like, doesn't smell so good. It's kind of
Yeah,
like, it's kind of like I remember I was watching a movie. It was the one, oh gosh, it was the one about the schoolmaster, and and he was watching the kids over school break. I'm blanking on the name. It won an Academy Award or something. But but he had I think what's called trimethylamine, a rare condition where you have like that fish odor smell, and apparently it comes
right.
out later in the day, which sounds god awful. But is something like that dangerous to somebody's health?
Well, it's certainly danger to their psychological health because as a child,
Yes.
all the other kids avoid them and
Right.
call them
Right.
funny names,
Right.
or bad names. So, in terms of whether they live longer or whether it has other effects, I really don't know.
Yeah.
It's a relatively rare condition.
Why do infants smell so good? Like when people go to smell a baby's head or their skin. What is it about them? Why do they smell so good?
I have no idea, Chris.
I'm asking you all these tough questions. I should have sent them ahead of time. You could have
Yeah,
researched
well,
them.
like baby powder and oils are used a lot in babies too.
That's
So
true. Yeah.
people love the smell of baby powder, but I'm not sure. There are sebaceous glands on the head that produce these odors, and that's true across the animal kingdom also. That and also there's imprinting that occurs in animals where you learn the odor in the nursing situation. The mother learns their offspring by the smell of the infants, and so there's a lot of interesting things about how even in utero, we know that rabbits that are injected with certain chemicals will prefer food later in life based on those chemicals. And pregnant rabbits that eat juniper berries, their offspring will prefer juniper berries more than
Mm.
offspring that weren't from pregnant ewes that weren't didn't eat juniper berries. So there's things that go on in utero even that sort of induces our preferences.
Hmm. Yeah, I know I'm getting catchy on the spot. I mean, through your career, and I know you've written books and articles, are any like really dramatic cases that like you just would never forget about a case that, um, in this whole area? Kind of like how I was telling you about the zinc deficiency. I mean, that was when I
Right.
read that case, that was like dramatic.
Yeah. Well, I think the biggest thing I've noticed in clinical practice is the complications of parents and children. Uh, for example, we had one child, a 12-year-old that came in, and the parents had taken them to clinics all over the world because this poor girl could not smell. Well, we had a pediatric smell test that we paid her 25 cents for everything that she got. And she started getting all these odors correct. So she was sort of manipulating the parents, in my opinion.
Oh,
And yet, when it was all said and done, I said, there's really nothing wrong here that I can see. She's doing really well. They were very upset with me because it was sort of a cognitive dissonance thing. They'd gone through so much money and everything. They thought that I was at fault. They wouldn't pay the bill.
ooh. You just give me an idea. A lot of times too, we all know that kids aren't the healthiest eaters, even though parents are trying harder than ever today. And sometimes healthy meals don't always smell as good as McDonald's. Is there a
Right.
way to kind of trick kids into, having some kind of good smell associated with to make them, desire and associate, certain foods?
Well, there's certainly that's been tried. You can, particularly in the elderly, you can supercharge the smells to make them more palatable for
Right.
people who have a lessened smell function. I'm sure for kids, there are certain odors that can make them smell like licorice or chocolate or whatever. You could probably get them to eat things that they wouldn't otherwise eat.
Yeah, I mean, because it's like, you go into, I haven't been there in about 25 years, but like you go into McDonald's. I mean, the first thing you kind of really smell is like the fries, wafting through the air there. And I don't know, that's definitely a good smell. I would keel over if I ate those fries, but I sometimes don't mind walking by and smelling them. Um, all right. So as we
Yeah,
conclude, Dr. Dottie, what would
sure.
be your tips for somebody as we're all getting a little bit older and we want to keep our sense of smell and taste sharp? The same way, people try to do certain brain games and people do visual things to keep their eyesight good. What would be if you were going to recommend to someone who came to you and said, "Look, I'm a little worried. It might be deteriorating a little bit my smell and taste." What kind of, things would you have me
Well,
do?
the big thing is to try to stay away from viruses.
Stay
And
away from viruses. Okay.
yeah, so if you're playing with your grandchildren, be careful.
Okay.
Things like that. Certainly, there's no simple, remedies to the age-related changes that occur in the sense of smell and taste. For example, between the ages of 65 and 80, half the population will have some demonstrable decrement in their smellability. And over the 80, 3 out of 4 will show that decrement. It's not much dissimilar, though, with vision and hearing as it drops off as we get older. There's always these changes that occur. I think the best thing, probably alcohol is not a good thing. There's certain things that,
Alcohol affects the sense of smell?
well, certainly it can have detrimental effects on cells, and so probably drinking a lot of alcohol is not a good idea. Uh, Staying healthy, eating properly, fresh air, filtered air. Interestingly, there's a study that shows the closer you live to a major highway, the more likely you are to get Alzheimer's disease.
Hmm.
So there is evidence of that sort that tells you that pollution is a big factor. So
Yeah, I
the
think I
more,
think that's a really important point. If anybody's listening to this whole thing, I mean, I think pollution is much bigger than people realize. Where would you go rank? You know, people obviously go, like as you were just starting to mention, go for vision tests every year or 2 years. As we get older, they go for hearing tests. I mean, nobody goes for a smell test, but how important do you think would you rank all of them? And do you think that maybe should become part of the annual physical in somebody 65 years and older?
Yeah, well, some companies actually do that. They do give smell tests that we've developed in their annual physicals. Uh,
Really?
yeah,
Okay.
there's a big movement on to for more universal olfactory testing. I think the big problem has been that you can measure it, but you can't necessarily treat it. You know, with vision, you can get glasses, or with hearing, you get hearing aids. Whereas with smell, there's really nothing out there yet that will really solve the problem, unless you do have polyps, you have nasal sinus disease, or steroids and things like this may be effective. But in general, most of the losses are not treatable in any significant way. So I think that's been why people are reluctant to do the testing, because if you can't do anything for it, why bother?
Yeah.
And
You
there's
know, it's so funny. I find at night, somebody told me about this. I have like this some cream when my hand gets very dry, and it's lavender. And sometimes I put a little bit on the tip of my nose. It just smells so good. It's just very relaxing. So I guess also certain scents can really, be calming and, have just other nice things, they don't have to necessarily
sure.
be medicinal.
Yeah, I mean, that's the whole cosmetic industry, and all the soaps and all the things we put on ourselves generally have nice smells.
Mhm. Well, Dr. Doty, I appreciate you taking the time to come on. I thought this was important. I think people should pay attention to smell and taste a little bit more. And of course, like everything else in life, you don't pay attention until you lose it. And maybe if we all pay attention a little bit earlier and do the best we can and avoid things like you said, pollution or medications, again, sometimes people again chronically use nasal sprays, not thinking there's any downside to that. But I think we kind of touched on a lot of important things. So thanks so much for your time.
It was my pleasure. Thank you for having me.
Okay.